Imagine you wake up on an operating table, the lights are blinding, your skin feels tight, and when you touch your back, you feel something pulsing under a scar, metal, alive, and not yours. You rush to a mirror and see wires glowing faintly beneath your skin. Someone has turned you into their experiment. Would you call that medicine or murder? Welcome to Movies English Rewind. Today we are explaining Anatomy 2, 2003, a dark thriller about science, ambition, and how far people go in the name of perfection. The movie begins with Joe, a young medical student playing chess with his brother Jan. Jan is paralyzed from the waist down, sharp, kind, and full of quiet pain. For Joe, every move on that chessboard feels like a reminder that he's losing a battle medicine hasn't yet solved. He promises his brother that one day he'll find a cure, no matter what it costs. Soon after, Joe travels from his small hometown to a big hospital in Berlin, where the best and most competitive interns are trained. The building looks modern, full of light, but beneath that light hides something darker. Joe joins as a new intern, full of hope, determination, and belief in science. He has no idea that this hospital will test not just his skills, but his soul. On his first day, Joe assists in surgeries, fascinated by precision and speed. Doctors here don't just operate, they dominate. They move like machines, emotionless, perfect. In the cafeteria, older students whisper about a secret group that practices real experiments. They say these doctors can rebuild nerves, restore motion, and even create muscle control from dead tissue. It sounds impossible, but for Joe, whose brother can't walk, it sounds like salvation. Late one night, Joe's skill catches the attention of Dr. Muller-LaRousse, the hospital's most feared and admired surgeon. Muller's hands never shake. His voice is calm, his logic cold. He invites Joe to a private research unit far below the hospital floors. There, Joe meets a team of 8 doctors. Brilliant, secretive, united by one goal, to create a human body that never fails. Muller calls it the Anti-Hippocratic Project. To them, the oath of do no harm is outdated. They believe real healing comes only when you break nature's rules. Joe listens, conflicted, half terrified, half inspired. In the lab, he witnesses things that should be impossible. Human muscles contracting without a pulse, nerves firing inside glass tanks, a patient's heart beating with mechanical precision after surgery. The doctors speak of evolution, humans upgraded by science. Joe's mind races. If they can rebuild a body, maybe they can rebuild his brother's legs. He agrees to join them. His badge gives him access to the underground floors. The deeper he goes, the colder the air feels, like the hospital itself is holding its breath. Training begins brutally. Joe learns to cut, stitch, replace. Sleep is a luxury. Mistakes are punished. Every experiment is filmed, every reaction measured. He's told emotion is weakness, that compassion clouds judgment, but sometimes, when he looks at the silent patients lying on the tables, he feels the weight of what they've lost. Days turn into weeks. Joe becomes faster, sharper, but emptier. He's praised for his progress, invited deeper into the circle. He tells himself it's worth it. If this is the price to save his brother, he'll pay it. Then one day, he notices something strange. A faint scar on his back, right above his spine. He doesn't remember it being there. It itches, burns. When he checks his medical report, that section is missing. Later, under an X-ray, he sees something metallic under his skin, a small implant glowing near his spinal cord. The horror sets in. Without permission, they've turned him into part of their experiment. He confronts Dr. Muller, demanding answers. The man smiles. He says Joe should be proud. He's living proof of their success. The implant, he claims, enhances coordination, removes fatigue, improves precision. He tells Joe, "You are the future of surgery." But Joe feels violated. He's no longer learning medicine. He is the medicine. From that day, Joe's every move is watched. His ID card tracks him. Doors open automatically. He's trapped in a hospital that pretends to heal while secretly dissecting humanity. One night, Joe meets Paula, another intern who once worked with the same team. She warns him. The group isn't curing people, they're replacing them. Failed subjects disappear. Data is erased. Their experiments are funded by corporations hungry for military-grade human upgrades. The hospital isn't a school. It's a factory of living prototypes. Joe wants to run, but he can't. His brother still needs him. And deep inside, a part of him still believes the research could save lives. That conflict between conscience and ambition eats him alive. A few days later, a patient dies during surgery. Muller orders Joe to perform an enhancement transplant. The team implants artificial nerves and restarts the body. The man wakes, breathing, moving, speaking. but his eyes are blank. Something human is gone. Joe realizes they haven't saved him. They've reprogrammed him. He feels sick, disgusted. This is not medicine anymore. It's manipulation wearing a lab coat. Paula urges Joe to help her expose the truth. Together, they record hidden footage, download files, and steal patient data. But the system senses rebellion. Security cameras flicker, alarms whisper. The lab feels alive and as if it knows what they're doing. The doctors close in, calm and smiling, scalpels ready. Joe and Paula are caught. Miller decides to correct them. He prepares Joe for a full-body enhancement, a complete transformation into the next generation of human prototype. Paula screams as they restrain him on the table. For a moment, the light reflects off the surgical blades, like tiny suns about to rise in hell. But before the procedure begins, Joe's survival instinct explodes. He rips off the wires, fights the surgeons, blood flying across sterile white walls. Paula breaks free, setting off an alarm. Sparks burst from machines, monitors shatter. The underground lab descends into chaos. Joe grabs Miller's notes, the proof of every illegal experiment, and runs through smoke-filled corridors. The doctor follows, shouting that Joe is making a mistake, that he's destroying the future. Joe turns back only once and says softly, "Then maybe the future needs saving?" They fight on the catwalk above the burning lab. Steel crashes, alarms wail. Miller slips, falling into the fiery chaos below, the creator consumed by his own creation. Joe collapses, shaking, half human, half broken. Paula pulls him out, and together they escape into the cold Berlin night. Outside, the city looks peaceful. Ambulances pass, lights flicker, and life continues. No one knows what happened below that hospital. No one knows how close science came to rewriting humanity. Joe uploads Miller's files to the media, sending the truth into the world like a heartbeat refusing to stop. Days later, the secret project is exposed. The society is dissolved. In the final scene, Joe returns home to his brother. Jan sits by the window, sunlight on his face. He looks at his own scar one last time. It no longer burns. It just reminds him to stay human. If you enjoyed this explanation, don't forget to like the video, share your thoughts in the comments, and subscribe to Movies English Rewind. Because here, every story reminds us, some experiments create medicine and some create monsters.